Hello everyone. Today we are here with Dr. Aysha Shabna, a specialist in Ayurvedic healthcare. Hi, Dr. Aysha. How are you?
Hi, I'm good.
So, could you start with telling a little bit about yourself and your journey within the Ayurvedic healthcare?
Hi, I'm Dr. Aysha Shabna. In 2026, I completed my 14 years of journey in Ayurveda. I studied in Kerala. I completed my BAMS and MD in Panchakarma from Kottakkal Ayurveda College. I have experience in Muscat, Oman, and since 2022, I'm working in UAE. And also, I'm an assistant professor in Panchakarma, Government Ayurveda College, Trivandrum. Why I choose Ayurveda? There is a backstory. At the age of 9, I was diagnosed as rheumatoid arthritis, and I was bedridden for years. The school time, I skipped most of the classes. So at that time, I found Ayurveda, and Ayurveda gave me a new life. I started walking, my health was improving. And at the time of career choosing, I didn't had a second thought. I already know that I wanted Ayurveda. So that's why I started Ayurveda.
Great. So, coming to my first question, Ayurveda emphasizes the balance of body, mind, and spirit. How do you apply these core principles while developing personalized treatment plans for patients?
In Ayurveda, we see the patient as the whole, not like this only the symptoms.
Right.
So when a patient come to me, I see the patient as I check their symptoms and their lifestyles and their diet and all. And according to that, I'll make a personalized treatment. We check the prakriti of the prakriti means the constitution of the patient.
Right.
Yeah, according to that constitution, we give personalized therapies. It will be different to different patients. Even the symptom is the same, but it will change according to the body constitution of the patient. Ayurveda usually check the patient's symptoms, their emotional state, their lifestyle change, even the mental state.
So how do you integrate traditional Ayurvedic practices with modern diagnostic approaches and contemporary healthcare understanding to achieve better patient outcomes?
Yeah, I strongly believe we have to combine both modern medicine and Ayurveda for the better outcome. So I use blood test and radiology, that is scanning, MRI, etc., for the clear picture of the condition of patient. And according to that, I will plan the treatment with Ayurveda principle. We'll check same the lifestyle and medications, and everything will be changed according to the reports or whatever they are getting.
So could you explain the significance of Panchkarma and how it supports overall wellness and disease prevention?
Panchakarma is a powerful detoxification rejuvenation therapy. Actually, due to our lifestyle and our food, the toxin will be accumulated in our body. So, in order to remove that, we have to do some purification. So, Panchakarma means it's a 5 kind of purification therapy. So, with this Panchakarma, we are taking out the toxins from the cellular level. It also help to improve your digestion and improve your metabolism, and it will give a whole well-being of the body.
So with the increasing prevalence of lifestyle-related conditions such as stress, digestive disorders, obesity, and metabolic issues, how can Ayurveda help address these modern health challenges?
Today's lifestyle issues like stress, obesity, and digestive problems are mainly due to imbalance of the routine and the diet. So Ayurveda address this by correcting daily habits and improving the digestion, that is Agni, and reducing the stress through therapies and herbal medicines and mindful practices like yoga and medication.
So Ayurveda places a strong importance on understanding and individual prakriti and doshas.
Yeah.
So how does this influence the choice of therapies, diet, and lifestyle recommendations?
Every individual is unique. And Ayurveda recognize this through their prakriti, that is body constitution, Vada, Pitta, and Kapha. And it will help us to decide right lifestyle, diet, and medicines for them. And this personalized approach is what make Ayurveda so unique.
So, what role do Ayurvedic herbs, natural remedies, and therapeutic formulations play in supporting long term health and healing?
Ayurvedic formulations and herbs that are natural and it works gently in the body. And they support the healing and improve the immunity and help to maintain the balance of body. Unlike quick fixes, they aim for a long-term health and addressing the root cause.
And how do you combine Ayurvedic therapies such as therapeutic massages, herbal treatment, yoga, and meditation to promote holistic well being?
Ayurveda is not just about internal herbal medicines. The therapies like Abhyanga, that is massage, Panchakarma therapies, that is detoxification, along with yoga and medication. This combination helps to relax our body, calm our mind, and improve overall energy and well being.
So, many people today seek natural approaches for stress management and mental wellness. How does Ayurveda help restore emotional balance and improve quality of life?
Ayurveda plays a huge role in mental health. It focuses on calming the mind through diet, lifestyle, and therapies. Practices like meditation, proper sleep, and gut health improvement are very important because our mental well being is closely connected to our digestion and lifestyle. As I mentioned before, so gut is the main thing in Ayurveda. So there is a thing called gut brain. So it is told that our gut also having a brain, that is enteric system.
Right.
So whatever we eat or whatever thing we take or emotion, it will affect in our normal brain also. Like I can give an example. So if we are in a very sad condition, we'll feel like a choking effect.
Right.
So it is the effect of the gut brain system. So if we correct the lifestyle and the gut, the mental health also will improve.
So, what are some common misconceptions about Ayurveda and what should people understand before starting an Ayurvedic treatment journey?
The important misconception is Ayurveda is slow and it is for minor problems. It is not like that. Ayurveda is very effective and very quick in conditions with the appropriate medicine. It is not for the small problems. Like usually, when I'm telling the friends or people I'm an Ayurveda doctor, they will ask for what is the remedy for hair fall,
Right.
pimples, dandruff. Ayurveda is not just for this dandruff and hair fall. We are treating all kind of diseases. And people think Ayurveda is just herbal remedies. Ayurveda is not just about herbal medicine. We have external therapies also and lifestyle recommendations also. There is Dinacharya and Ritucharya. Dinacharya means daily routine, what we have to do from waking up till sleep. There's also mentioned the time when we have to wake up, what we have to do just after waking up, and what food we have to eat according to the prakriti, what food we have to avoid and everything. And there is Ritucharya also. Ritu means season. In every season we have to do some regimens. Okay, that in winter certain food have to be avoid, certain things have to be avoid, and in summer like that it is mentioned elaborately.
So, looking ahead, how do you see the role of Ayurveda evolving in the wider GCC region? And what opportunities exist for greater integration of traditional wellness practices?
Ayurveda has a promising future in GCC, especially in UAE. People's awareness about holistic health are attracting them to the natural remedies, which is Ayurveda. Not only Indian people, but also the Arabs and other nationalities are seeking natural remedies. We can see that many Arabs are coming to Kerala for the treatment, but now we have more than 100 clinics in UAE, that is Ayurveda. So we can see the growth of Ayurveda in UAE. The incidence of obesity and heart attacks is increasing in the young people. That is because of their food and lifestyles.
I think that is all. Thank you so much for speaking with us. That was Dr. Aisha for Mediworld.
Thank you.